Yes, yes, yes. Welcome to another episode of Hip Hop Hooray, Men Talking Health. I am your MC for this morning. I am Oya Gilbert, and we have a really balls program for you today. In the building, I have two of my dope constituents, and I have Gary, and I have Dr. Brandon Blue, and we are going to discuss and have a great conversation about multiple myeloma, clinical trials, and all that wonderful stuff. And I'm just super excited. I am going to give them a brief opportunity to introduce themselves. And I thank you, gentlemen, for joining the podcast. How you guys doing today?
Doing pretty good. Thank you.
Yeah, man, this is a great opportunity. So I'm ready to give a good discussion today. Give the listeners what they want.
Hi, Dr. Blue. I don't know if I should call him Brandon, Blue, MC. Nah, I'm just messing around. But I wanted to jump to you, Gary. Please introduce yourself and please tell us, briefly your diagnosis, who you are, and then we'll go to you, Dr. Blue.
All right. So, Gary Lambert. I live in Florida. I've had myeloma since 2014. So I'm on my 11th year of it. I'm living with myeloma.
And where did you say you was from, Gary?
So I live in Florida, but I grew up in Philadelphia, and I'm originally from Jamaica.
Okay, that's important, player. That's important, Philly, and then Jamaica. Before we move on, my condolences to all those in Jamaica and the situation going on. I hope your family and everybody, your loved ones are safe.
Yeah, thank you.
No problem. So, Mr. Dr. Blue, please introduce yourself.
All right, how's everybody doing? I am Dr. Brandon Blue. I am from Florida, currently work in Florida at Moffitt Cancer Center. I'm a multiple myeloma physician. And so what that means is I'm a person who sees multiple myeloma all day, every day. I see all aspects of multiple myeloma, whether it be CAR T-cell therapy, whether it be stem cell transplant, whether it be newly diagnosed, people whose disease has relapsed. I see it all. And I'm just here to kind of shed some light on the education and let the people know about this disease, what we can do about it, and how to make things better for people.
I appreciate that. Appreciate you both being here. I'm going to dive right straight into it. Dr. Blue, what inspired you to specialize in multiple myeloma and blood cancers?
Man, so, I'll say that for me, growing up, I really didn't know what I was going to do, if I'm being 100% honest. My mom told me if you get good grades, good things will happen. So I just kept getting good grades and then things will happen. And then when I was in high school, I wanted a class ring. I don't know if they still do class ring. I might be dating myself.
Yeah. They still do. They still do.
Oh, they do. Okay.
They a lot more expensive and look a lot better. They're a lot more expensive and look a lot better.
Well, listen, we didn't have that much money growing up. So for me, my class ring was still expensive. You know what I mean? Right. And so my mom was like, hey, I'm not paying for that. That's what she told me. And so I said, all right. Well, she said, well, if you want it, you got to get a job. So I got a job at a nursing home that was across the street from my house, and I worked in the kitchen. Oh. And so doing that, I kind of got exposed to seeing people who kind of were sick, people who really weren't doing it at their best. And I was like, all right, I think I can kind of mix, helping people who are sick with some of my love for math and science. And so when I got to college, I said, all right, how can I do this? And so I said, all right, I'm going to be a doctor. But then, at every turn, everybody was like, well, what kind of doctor you want to be? You're like, right. I'm just happy I made it. You know what I mean? So then I'm like, all right. So then, I had some time in the operating room and doing surgeries, delivering babies, all that kind of stuff. And I was like, I am not delivering these babies at 2 and 3 o'clock in the morning. Like, that is not for me. And so one of the things is when I had my oncology rotation, I always used to get in trouble because they were like, you're spending too much time with those cancer patients. You got to go in and get out, And I was like, I like talking to people. And I realized that, for me, talking to people is something that I felt very comfortable with. People feel comfortable with me. And so allowing me to do that, I think really worked out. And then for me, I was like, all right, well, I want to do something where the field is changing, right? I don't want to be given the same aspirin that they was given 50 years ago, right? You know what I mean? And so I was like, all right, well, let's, do something, because the world of cancer is changing all the time.
Right.
And so then I became a cancer doctor, and then they was like, well, now you're a cancer doctor, what are you going to specialize in? And so I'm like, oh my God. So then it was another round of trying to figure out, breast cancer, lung cancer, all these different types of cancers. And then when I got to multiple myeloma, and I'm like, all these people look like me. And not only do they look like me, they're not too much older than me. Like these people are almost my age. So what's happening here? And it was something that people hadn't even heard of. Right. And so I was like, oh, this is, stop the show. I gotta help. This is what I'm meant to do. You know what I mean? And so fast forward, that's where I'm at, and that's where I stayed.
Well, we certainly, being a myeloma patient myself, we appreciate you being in this space. It is not a lot of physicians in hematology that look like us, but we're doing better. And speaking to that, being a Black physician in hematology, what does representation mean to you, both in the clinic and also in the community?
Yeah. So the first thing I would say is that when anybody gets a diagnosis of cancer, the first emotion is fear, right? Mm-hmm. There's never been a time when I've told someone, hey, you have cancer, that they was like, all right, that's never happened. You know what I mean? It's always, all right, well, what's going to happen next, doc? How long I got? Those are the types of questions. Even if they don't say it, that's what they're thinking, right? Mm-hmm. So then I said, all right, well, imagine you have a diagnosis of cancer and not even really understanding what the cancer is. And so what I'm able to do is I can talk to people who, maybe school just wasn't their thing. You know what I mean?
Right.
Using some of multiple myeloma is a very complicated disease, right? And so it's a lot of very scientific terms that if you don't really understand those terms, people, they get lost. They just know they got cancer somewhere, and you tell them that it's not curable, right? And so people just get scared. And so I'm able to kind of just look, this is what it is. This is what's going on. And so I think it really helps people connect, because they can actually understand what's going on with their body, because now they can explain it to their wife, their husband, the kids, because otherwise they can't even explain it, even though it's something that they personally have. So I would say that happens in the clinic all the time.
Man,
and then I would say in the community, my biggest mouthpiece is trying to say, all right, well, how do we tell people who are the most at risk? Meaning that, yeah, they might not have multiple myeloma now, but how do they know if they may develop it? So what I've been doing is not even just around Tampa and around Florida, but really throughout the country, is I would go to different places where there be certain churches or community events. And I just kind of tell them, and I'm like, look, this is a cancer that happens typically in minorities, whether you be African descent or you be in the Hispanic community. This is something that is affecting us, and it might get missed when you go to the emergency room because we get it younger than what the medical textbooks say, right? So this is something that your doctor might say, what do you mean? You 50 years old.
Right.
This happens to people who are 70, right?
Mm-hmm.
But it for us at a younger age. And so it allows me to really kind of help educate people. And I'll be honest with you, it allows people who may not be my patients to come and ask me questions, and I can explain it to them, right? Because, we barbershop, we at the church, they feel very comfortable, and it works out, man. And so for me, it's been a blessing, man, being able to help others, if I'm being 100% with you.
Man, I appreciate that. I appreciate your transparency. Even when you told the story about your mom Dukes talking about, hey, you had to do something. But before I move on to Gary real quick, I want to be clear and make sure, and I'll have you do this, Dr. Blue. Please explain to the audience what multiple myeloma is. We've kind of just breezed over and just assumed that they do. So please briefly explain that before I go to Gary.
Yeah. So I want people to understand multiple myeloma is a cancer that happens primarily in the bone marrow. And what happens is that bone marrow that's actually inside of your bones. Now, I'm from the South now, Oya. So you from the Northeast. So you might not know about this, but down in the South, we actually eat the marrow out the bones. You know what I mean?
That's chicken. Yeah, I know. Y'all get down.
Right? You know what I'm saying?
So that's just a South thing, though, player.
I don't know, man. I just know in the South we tears it up. You know what I mean?
Right.
So inside of those bones is that marrow, but that marrow can become cancerous. And the problem that happens is that as that marrow fills up with cancer cells, then unfortunately what happens is that breaks the bones many times,
Mm-hmm.
because it's kind of like a woman when they're pregnant with a child, is that at 9 months, if you got a woman who's pregnant, she like, take me to the doctor, this baby ain't no more room left.
Right.
Well, if there's cancer inside of that bone marrow and then there ain't no more room left, what happens is that cancer still grows. And unfortunately, it starts to break those bones, but it's breaking it from the inside out. And that can be quite painful. So a lot of people, when they have this disease, might have things like back pain. But then you ask other people, oh, you have back pain, they think it's no big deal. They try to tell you take some Tylenol and they say it's okay, but the whole time it's really a cancer that's growing. Or one of the other things that can happen is because that cancer starts off in the bone marrow. Well, the bone marrow is what makes the blood. So the more cancer that you have in the bone marrow, the more cancer that we can see in your blood.
Mm-hmm.
Well, the issue is that we have kidneys that act like a big filter. And so with that big filter, they're like a big fishing net. Now, if you got a fishing net, and again, I'm from the South, so I got to talk about it.
Break it down.
Now, in the South, when you catch fish, all right, you can't have more fish than what your net can hold. Does that make sense?
Yes.
You know what I'm saying? Or else that net gonna break.
Absolutely.
And so the same thing happens with myeloma, is that your kidneys are used to catching stuff like a big fishing net, but now you have all these extra cancer cells and it's too much fish
A lot of
in that net. And so the kidneys unfortunately shut down. But then you go to the doctor, and again, you might be a younger African-American, and it might say, oh, well, you got high blood pressure, or you got diabetes or something else, when the whole time it was really cancer cells in the blood that's causing the kidneys to shut down. So that's why, unfortunately, for a lot of like diseases, it can actually pretend like it's something else, and people might actually think you got something else.
Right.
But the whole time it's multiple myeloma. So I know that's super complicated, but really, it's one of those diseases that just it affects people, and it doesn't have some kind of telltale sign like some of the other cancers. So, for example, I'm not sure if you ever did a talk on breast cancer, but if you tell a woman, hey, there's a lump in your breast, the woman can say, hey, that makes sense to me. Well, this doesn't have something that you can touch or feel.
Right.
It's just one of those things where it could be pain or kidney damage or some of those kind of things, but it's still a really big problem, and it is affecting our community literally every day.
Man, I think you explained it perfectly, and I don't think you need to be from the South to understand your analogy. So I'm totally with it. I know what fishing is, and I get, I know if you overdo it and it's too much, then it needs to make room, or the net will break, and you lose.
Yeah, well, I just know in the South, we love our fish and grits and shrimp and grits. You know what I mean? I think in the North, y'all, I don't know what y'all do in the North, but we like our grits down here.
So. Yeah, I like grits too. Listen, I got you. So, hey, Gary, man, listen, I appreciate you being here, brother. Please, brother, take us back. What it was, like before your diagnosis, because you were diagnosed, I believe, in 2004. And tell us what it was like before the diagnosis, and, what type of a life you were living prior to the diagnosis and leading up to the diagnosis.
So I was diagnosed in 2014. So I've had it for 11 years. To be honest with you, it was a fairly okay life. I was fairly active, I guess. At the time, I was into a lot of outdoor activities. I was a cyclist, runner, just being outdoors. Philadelphia can be a very active city. So, we have a lot of marathon and races and things like that. So I was kind of part of that community. I also worked for the city of Philadelphia. So, that played a role in me being able to deal with this thing, and at the same time still being able to work. Because I had an employer that at the time granted me a lot of leeway to attend treatments and things like that.
Now, you're a law enforcement officer, right? Is that right?
I was.
Oh, maybe I said that. My fault.
No. It's good. It's good because I'm retired. But I was a probation parole officer.
Okay.
So, I kind of just, I had my duties kind of were split between being out in the streets and doing field work and being in the office and being in the courtroom. So, there was a lot of flexibility in terms of demands on my body, but I was into running, cycling and things like that. And it was I started seeing symptoms in early 2014. And to go back to what Dr. Blue was saying, about how when people are getting diagnosed, symptoms they can confuse their symptoms for something else. I had the typical back pain, hip pain, um, you know, that gradually, progressively got worse. I tried physical therapy. I saw my sports medicine doctor. They prescribed like medication. Just nothing ever really worked. Steroids after a while, and that seemed to provide some relief. Um, but throughout that year, from March when I did my first running event for that year in the Love Run in March of 2014 to the fall of that year, I just progressively got worse to the point where I couldn't really walk on my own. I had to have a cane or a walker with me. So I went from starting off the year doing half marathons and things like that to not being able to walk by the end But it wasn't until later in the fall of that year, around October, when they found spots on some x-rays. I've had x-rays before, but nothing was showing up. Then all of a sudden they did another set of x-rays, maybe my third set. Then they saw these tiny spots, and that's when they ordered the MRI. And then next thing I know, they're starting to put two and two together. I'm seeing an orthopedic oncologist to determine if rods need to be put into my femur and things like that. By the time the biopsies came back, it was just about my 38th birthday. I was 38 at the time I got my diagnosis. It was the day before my birthday. And they officially told me I had myeloma and that within the next 10 days, I'll probably be starting my RVD treatment. And so that was it. The better part of a whole year it took for them to get me diagnosed and get me onto treatment. By then I was already stage 3. So by then I was stage 3 and I had maybe just over 80% involvement in my bone marrow.
Gotcha. And so RVD is Revlimid, Velcade, and Dex. For those that don't know, we're gonna break down these acronyms for our listeners. And as you said, you were very active in Philadelphia. You were just an active person. Once you got to the diagnosis, I'm sure that was a shocker to you and very heavy. What was on your mind that day when they told you, hey, you have this disease, it's incurable? Can you take us back to that moment and, as far as what you were thinking in your emotion?
So, it was an interesting experience because, with a lot of people, with most Americans, and especially Black Americans or people, we are no strangers to cancer in general. Mm-hmm. So, but the experiences that we have with it when we look at loved ones who have had it and gone through treatment does shape our perception of how we want to deal with it when it does happen to us. So fortunately for me, and it's a very unfortunate thing, I had my wife with me while I was going through this process. And I don't think a lot of people understand the importance of having an advocate or having somebody who's there who can basically step up when you are dealing with the shock of this initial news. So I literally remember being at meeting with the orthopedic oncologist, and he was saying that the biopsies haven't come back yet, but it's looking like multiple myeloma. And my first reaction was, what is that? And then my wife's reaction was oh, wow, that's pretty serious. And I'm looking at her, I'm like, you know what multiple myeloma is? And she's like, yeah, I know about it. I don't know a whole lot about it, but I've heard of it. And I know that, it affects African Americans mostly and usually older people. And she literally stepped into that role of asking questions. And I'm not going to lie to you, those few weeks of my initial diagnosis was kind of a blur because, I was kind of blurred out, in my mind because I'm still trying to come to terms with what's happening. But she stepped up. She's the one that asked all the questions, got all the information that they needed in order to get the insurance to approve the treatment. every time we had doctors, she had her list of questions that she wanted to ask, and things of that nature. So she kind of stepped up into that, advocacy role, and she made the transition from me to go from, from like, I don't know what's wrong with me to like straight on like, treatment for the induction period. And, she was there the whole time and handled a lot of those things. So that was how I personally was able to overcome some of the challenges in the beginning.
Got you.
And I'm gonna tell you this, Oya, that she's still doing that to this day. She still got her list of questions. She still be ready and be like, "Well, Dr. Blue, what we gonna do next? What's happening?" So,
Yeah.
so she started that at the beginning, but don't think that she fell off. Even though it's been 11 years, she's still right there researching stuff, googling stuff. So, listen, man, it's good to have a ride or die. So I'm glad that you got that.
I was just about to chime in with that same sentiment. First of all, that's a blessing, and shout out to Wifey for, doing all the things that are important when you have a care partner of that nature. And, unfortunately, we're not all blessed with that scenario. And so some of the things, I have seen in the past as far as suggestions is definitely, whether you got somebody with you or not, is, record those conversations when you're talking to your doctors, because they can. And even in today's time, as Dr. Blue can probably tell you, they're using a lot of technology and ask you permission to record the conversation as well, just so you can recap it. Because especially in the beginning, it is a lot to digest. And I mean, an absolute ton of stuff to digest. Just the fact that you just found out you have cancer. And of course, the second component to it is that it's incurable. And I know, Gary, you definitely, I know you got a stem cell transplant, but you also received CAR T therapy. How did those two experiences test your faith and your fight, towards the disease? Because as you said, Wifey was doing her research and probably asking all the wonderful right questions. So can you explain that and how those two therapies worked out in your life?
So, I mean, it was kind of interesting because we spoke about the RVD. I ran into a hiccup during the induction period to prepare for my bone marrow, where the Velcade caused some heart damage for me. So that delayed my my stem cell transplant for a little bit of time till they could figure out a new drug and get my heart function to get out of heart failure and into the normal range, and switch up some medications. I think they put me on Caprylus at one point, but it was just it was a rough ride in the beginning, getting to that bone marrow transplant, just dealing with the infections and getting into septic shock and all that other stuff. Because I was stage 3, I was pretty far along. So, my recovery was a little bit slow once I got on the medication. But once I got to the bone marrow transplant, it was a typical bone marrow transplant. It was, I didn't have a donor. They just used my own stem cells.
Okay.
And it was okay. I had a partial response, so I didn't really achieve like anything close to remission, but the disease was stable. So I was on Revlimid for a couple of years, and then I stopped responding to that, and that's when they put me on, Darzalex, when it first got approved. Shortly after it got approved in 2017, I got on Darzalex, and I think it was around the time I got on Darzalex was like an interesting point in my journey. That was when the word of CAR T was starting to be heard in the community in a clinical trial setting. A lot of the clinical trials, like the Bluebird trials, didn't come around to like 2019, if I recall. But by the time 2017, 2018 came around, I started doing my own investigation. I have a science background, so, science in general interests me a lot.
Okay.
So I started meeting with second myeloma specialist at Penn University, Dr. Vogel. And he was running his own clinical trials on CAR T at the time. I never participated in them for a number of reasons, but while I was receiving my primary treatment at Jefferson Hospital, I was also meeting with him to get second opinions on future treatments if the Darzalex wasn't working too well for me. 2019 came around, and that was when I realized, mentally I had to start thinking about my journey a little differently. I'm sorry if I'm going over time.
Do your thing, man. No, there ain't no time, man. We got this. Go ahead, man.
But it was around 2019, after 5 years of dealing with myeloma, that I realized that I couldn't really look at life the way I was looking at it before. So traditionally, when I got diagnosed, I was like, okay, I get this, I go through treatment, I get the bone marrow, I can go back to work, I can work on my career, I can just, do the normal things that I was doing before. It wasn't really working out. Like by 2019, my body was pretty broken down. I still had disease involvement. I'm still going into the hospital every month for injections, because at that point we were in the Darzalex hospital. So we were in injections every month or infusions, and I think that I just needed something to give. I can't work as much anymore. It's too physically demanding. I'm in a lot of pain. So at that point, I made the decision that I was going to leave my career, leave a lot of things behind. I moved to Tampa, Florida for, better treatment and better quality of life.
Mm-hmm.
It wasn't a random decision. I actually spent a good number of time researching myeloma specialists around the country. And we came up with a list. My wife and I decided on doctors that probably would help me. I read through some of Dr. Blue's research paper, some of his earlier research work, and I kind of like the idea. So in late 2019, we toured Moffitt. We came down here, and we toured Moffitt, and we spent a week in Tampa. And I think we were happy with things. And then we went back to Philadelphia, and I made preparations to retire, and just to put our house up for sale and all this other stuff. But
I'm sorry, go ahead.
Yeah, no, go on.
No, I was just gonna say, because you got ahead of me on that. Was one of the questions. I was gonna say, how did you even catch up with Dr. Blue? I mean, not to say Dr. Blue everywhere, but the point is that I was just trying to figure it out. So that was a great lead in. But I want to just, before I go to Dr. Blue and for him to explain what CAR T therapy is, cell therapy is. You mentioned about the other doctor clinical trials, and he's like, for a multitude of reasons, you didn't do it at that time frame. Then later, you're like, okay, I checked into some stuff, your quality of life. What was it that was making you say, nah, I'm not going to do a clinical trial? And you don't have to get super crazy with it, but I definitely want you to be honest about it. But what was stopping you from that?
So that was I'm sorry. A lot of things play into role. Like when you decide that you're going to do a treatment, you have to kind of take into consideration the weight of what stage they are in a clinical trial, whether or not you're a good fit, physically, mentally, the position you are with your family. So here's the thing. At the time and I was trying to get to that point because it's a complicated question, because in 2019, the clinical trials, like the Bluebird trials and stuff, were kind of like stage 2, stage 3, maybe clinical trial with the FDA. They were still basically looking for people who had multiple lines of treatment, people who were not responding to current treatments, and the results were very, I don't want to use the word all over the place, but a lot of the results was like some people were doing well and some people weren't. At the time, for me personally, I was still young. I was stable in Darzalex. I still have 2 young children. I couldn't afford to take the risk. I had a heart condition that was also, in some cases, a disqualifying factor. When you do the pre-workup, they want you to have an injection fraction of a certain number.
Mm-hmm.
Mine was kind of still on the lower end, even though I technically could have done it, but I wasn't, Dr. Vogel and we just weren't too comfortable. There was just a lot of risks that at the time that I just felt like I wasn't ready for that level of risk, if you get what I'm saying.
Absolutely.
So we decided that we should just wait until and see how first, how much more further the clinical trials go, and whether they can stabilize, or make the necessary tweaks to get it safer and improve the efficacy and safety on it. And at the time, he was also like, there's also another thing called bispecifics that's coming out that I'm also looking into. So he uses like, if you could wait out like another year or two, or longer, let's just wait until see how far along this really goes. It's very promising, but it's still in the early stage. And I wasn't really ready for that risk at that point. So in the meantime, I made the other preparations that we spoke about before to my life. I made the other changes to my life. I just went along with those. And at the same time, keeping the back of my head that CAR T is out there. It's a backup plan. It's something that I may need to look into in the future.
Understood. I just was curious, and thank you, brother, for sharing that and being transparent. Those make logical. It sounds like he was definitely using logic and emotion and all the proper things, and you were educated. So that's super important for the listeners to understand that no two scenarios are the same when it comes to any type of therapy, especially participating in clinical trials. Hey, Dr. Blue, I'm gonna get back to you.
Talk to me.
Gary went, eventually did go get CAR T cell therapy. Can you explain that in plain language? Because, I know it's complex. Tell them what the acronym means, then break it down so the regular folk can understand it.
Yeah, so you'll see and hear the abbreviation CAR T cell. That stands for chimeric antigen receptor T cell therapy. And so really what that is it's the most natural way to kill cancer. So what happens is that we use your own body's immune system to be able to fight off cancer. So let's take Gary, for example. So what happens is that Gary had a natural immune system that throughout his whole life has been fighting off infections. So he had the soldiers that are ready to fight. We just said, hey, let's fight the cancer. And so what we did was we collected some of those T cells or those soldiers that are used to fighting, and then we had to process them and basically let them recognize Gary's cancer and say, look, there's a new enemy. There's somebody who I want you to take care of. And we put those new cells back into his body. Again, his own body, his own cells. So this isn't some medication from a pharmacy. Like this is his own immune system. We just taught them a new trick. You know what I mean?
Mm-hmm.
And so once those cells have been infused into his body, now these soldiers can recognize his cancer, and they took care of it. And since that time, I don't want to spill the ending, but Gary's soldiers have been fighting since that time, and he hasn't required any other myeloma treatment. So these soldiers are still to this day looking for any little crumb of cancer, since we taught them how to take care of it, boom,
wow,
they go to work.
It's every time I hear it, it reminds me, remember the cartoon The Jetsons? It just reminds me of some sci-fi stuff. But this is not sci-fi now. It's real-time reality. And obviously, when Gary was doing it, I know at that time frame, it still was, I always say, you talked about working out the kinks. That's what I like to try to say. But now, in today's time, CAR T is getting better and better, which is the step up from there is bispecific, which is a whole nother level of it. But, CAR T therapy, the CAR T cell therapy is being improved every single day. And so I appreciate the way you explained that. But what do you think are some of the barriers that you see keeping men, especially Black men, from early detection of this disease and clinical trials, wanting to be a part of clinical trials?
Yeah. So, I would just say is two things. The first thing I would say is myeloma is just something that is just not heard of, right? So before we had this podcast, people probably would never understand what this is. So I'm glad that we have this opportunity to explain to people about a disease that's hurting us, right?
Right.
So again, like Gary said, he had back pain. You know what I mean?
Yeah.
He was in his 30s, right?
Right. Which ain't
That
really
wasn't on nobody's radar. You know
right.
what I mean?
Right.
And so that's the thing is that, and you heard what he said. I didn't prompt him to say that. Gary said his first question was, what the heck is that? They tell me I have this thing, but what is it? I never even heard of it. Right. So like, for example,
I did the same thing.
Exactly. I mean, that's natural, right? So, if you turn on any television show during the whole month of October, everybody wearing pink socks and pink shirts because they're doing breast cancer awareness. So at least, even if you don't really understand breast cancer, you at least say, all right, I remember I was watching a football game and they talked about breast cancer. Like you at least have heard and know a little bit. But we just don't get the same publicity when it comes to multiple myeloma. So I think that's really the big issue, is that we just got to raise more awareness. So that's why I'm thankful for the podcast. The second thing is that, whether people like it or not, what happens is that for a lot of, I'm just going to say for us brothers, like, the world looks at us differently than anybody else. You know what I mean? Right. And so when it comes to clinical trials, those are things that we rightfully so are a little bit skeptical. It's like, do they really have our best interests at heart? Like the world puts us at the end of every line. And then now you're saying, now you want me to be at the front, and for me to just be like, okay, let me sign up, so I get that, right? Like, you know what I mean? And so I think that's where it comes in to say, hey, maybe you come see a Dr. Blue like me, where I'm talking to you and I'm like, look, brother, we the same, you know what I'm saying? We cut from the same cloth. Let me tell you why I think this is or is not a good idea for you, right? You know what I mean? And I think sometimes too, if I'm being 100% honest, I think sometimes people force people to try to choose clinical trials, right? Like to say, you got to do it, and people are like, whoa, I ain't gotta,
right.
You know what I'm saying?
Slow down, pump your brakes for a second.
Yeah, and I think for us, I think you got to ease your way into it. I think it's a right and a wrong way to do everything, right? And I think that's where like culture comes in, right? Like understanding culture, understanding people, understanding because again, you walking a mile in somebody else's shoes, right? Like what that looks like. And so I think that's where it takes doctors who can really have a strong rapport with the people who they're taking care of, so they can actually know what's the right fit. Just because you have a tool in your tool belt don't mean you got to use it, right? You know what I mean? And it may not be the right thing for the right person.
Right.
So I think those are the things that come up all the time.
No, I appreciate that. And one of the things, to your point, when it comes to clinical trials, we have all these preconceived notions. And I always say, hey, I get what happened in the past, and I'm not dismissing that in any shape, form, or fashion. However, what I will say is, first of all, there are regulations and rules that are in place now to help to deter that thing. Doesn't mean it's impossible, but to help deter it than it was back then in the Tuskegee days and all those type of things. That's first thing. The second thing is also, we have an opportunity, even in this particular platform right here, to have a seat at the table. Now, the thing I always say is, when you go sit at the table, please don't be quiet. Go ahead and ask those tough questions so that we can help eliminate some of those preconceived notions about clinical trials. And, it's a Frankenstein thing. And I just recently came back from one of the labs where they start the whole process of creating the drugs. And what I can tell you from firsthand is they didn't look like me, but this is their passion. Like, this is what I'm trying to get people to understand. It's like, it's not, these pharmaceutical giants hire these people and say, hey, create this weird thing for somebody. These people really care about the job that they're doing, no different than the job that, you do. And so that's one of the things I learned. And they really want to create it. They really are trying to cure disease. This is what they do. This is their passion. So I appreciate you sharing that. Gary, Dr. Blues is, I know a lot of doctors, but Dr. Blues pretty dope. He spit some rhymes to me one time. He used to rap. I'm gonna put all your business out here, Dr. Blues. But Gary, it's important, a doctor-patient relationship. Can you talk about your doctor-patient teamwork? What does that mean to you, Gary? a doctor-patient relationship, or your healthcare team relationship?
I mean, I think it's extremely important. Like, I don't know if there is a way for me to basically explain to somebody just how important that relationship is. I've had an excellent relationship with all my doctors. Before I met Dr. Blue, I had several other myeloma specialists and doctors that I saw, and I've had great relationships with every one of them. And it means a lot. Like, I spoke about, the clinical trial where, the doctor's explaining to you, through numbers and science and through, an objective point of view as to why this may not be the right time for me. Not to say that this drug may not, or the treatment may not be right for me, but timing is very important. Like, everyone's circumstances are completely different, and you have to factor those things in, you know, and it was a clinical trial time, and he's just like, maybe, you need to wait until see how further along, wait till the FDA approved, and then things can change. And so having these discussions and meeting with these doctors is extremely important because, in my opinion, the better your relationship is with your team, it's usually the better the outcome of that patient is in the long run.
Mm-hmm.
Dr. Blue spoke about earlier in the beginning that, he talked a lot to his patients, and he does. Like, when I go and see him or his team, sometimes we're actually talking in upwards, a visit can be in upwards of an hour. I don't want to get him into trouble for over but I respect that. Like, we have conversations, not just about my treatment and about things, but about life in general. Because the more he understands my life and my situation, the best he can come up with a treatment plan that is going to meet what it is that I expect out of life. So,
listen,
and that's,
he downplaying it, man. They got to pull us out the room. They say, "Oh, here come Gary again." Dr. Blue. They set a clock and they say, "Well, we got to come." They literally have to come pull me out. Lord have mercy.
Man, that is so dope. I mean, Gary, you said you don't really know how to explain it, but you just did, my man. Like, for real, it is so paramount. What you just spoke of, because it's one of the things that I have not had a lot of in my journey with my healthcare team. It's that personal relationship, because, man, back in the day, you had the same doctor from when you was a child to the day you maybe went out of here. And, unfortunately, time doesn't allow that, but it's important to, especially with a disease that has so many layers and so much complexity, to have that. But it's important to, like you said, to know something about the person. That's how you create trust. Is like, I'm sure he knows. And what people didn't get to see is, prior to recording, before we went on the air here, they were having a conversation about his family being in Jamaica. Like, I could tell. I was just on the sidelines listening. They have a relationship. And that's what I believe is important and should be in all of the spaces dealing with patient to doctor. So I think you explained it very well, Gary. Dr. Blue.
I think it's important. I just want to say, the one thing that I think people miss is that, you're more than just your cancer, right? Like, the cancer is just one page in your story. You know what I mean? But you are somebody's brother, you're somebody's son, you're somebody's father, you know what I mean? And, there's more to life, you know what I mean? And so that can't get lost in the sauce. You know what I mean? Like, yes, the cancer is an important page, and for sure it's a chapter that we want to make sure that we, read, you know what I mean, and take care of. But know that it's not the full book. You know what I mean? And so that's what's important.
So, Dr. Blue, with that being said, and
that's a bar, just so you know. That's
I was going to say bar. How do you think? And this goes for you, but actually both of you can answer this question. How can we build stronger bridges between medicine and culture, between doctors and the communities that we serve, or that you serve?
Yeah, I would just say, for me, man, I think if I'm being honest, I think we need more people that come from our culture, right? Like, you know what I'm saying? Like, because that way you don't have to teach it, right? Like, this is natural, right? And so, we do try to teach it because I know that it's not I can't clone myself, right, and be everywhere, but I do think that it's important, I think, really just for people to listen. Like, I think that's really the big issue. And I'll be honest, and all the doctors or healthcare folks who might be listening to this podcast, they understand that sometimes it's not that we don't even want to listen. We have external pressures, right? So like people would go in and be like, all right, you're going to see Gary. You got 15 minutes. You know what I mean? And so Gary might have something that he needs to explain that, might take him 10 minutes just to explain.
Right.
And then I can't even say, oh, well, you got questions? No. And, so people get upset and then they say, oh, well, my doctor didn't even let me ask questions. Like, because sometimes what happens is that we have certain pressures on us to be like, all right, you got it, on to the next, right? You know what I mean? Because at the end of the day, healthcare is a business, right? But I think that it takes the provider, right, to look and take a step back and be like, look, this is this person's life. Like, I'm not rushing that. Like, you know what I mean? Like I'm the type of person, I don't care if I get in trouble for talking too much. Cause I get in trouble every day for talking too much. Like that, like you're laughing, but it happens.
I'm just not a doctor, but I get in trouble.
And so I'm like, I'm cool with saying, hey, I got in trouble because I wanted to make sure that this person actually is doing okay and not just saying okay. Because, like your reaction if somebody says, how you doing today, is to say okay. But like, that's not sometimes really how you feeling, right? Like, you know what I mean? And sometimes it takes that extra pause to be like, you sure? You know what I mean? And just that extra you show, you know what I mean, could be the thing that really makes a difference, And so I think that's what needs to happen at the end of the day.
Man, Dr. Blue, I appreciate that, man. We need more Dr. Blue. And I know they out there, but we need more pushback on that to normalize the fact that the human side of this thing is that, like you said, I know it's all big business and everything, but these are people's lives at stake while we're talking about big business. And I just mentioned before, how much is one life worth? If you ask me, my life is priceless. You can't put a price tag on it. And I think that's important for us to make sure that we take the time to, if you don't like what you're receiving, the type of care you're receiving with your doctor, you do have options to, and not everybody. I know in some places they're limited based on zip code or things of that nature, but you have a right to also go up the ladder and complain. It's not a bad thing because once again, it's your life that's at stake. So I think that's,
I'll tell you one thing, Oya, is that what COVID taught us is that you can have communications with people and not be in the same city.
Correct.
Not be in, like the use of virtual visits and what they call telehealth is important. So, what I always tell people is like, look, if you can't travel to Tampa or you can't travel to whatever the big city is that's near you, maybe you just do a virtual visit, right? Like, and even if you don't got Wi-Fi, you can do it from the McDonald's parking lot, right? You can connect free to the McDonald's parking lot and you can just say, hey, I just need a Wi-Fi connection that I can do it from my phone, right?
You get
Have a doctor that is an expert. Look at your files and just say, all right, they doing all the right stuff, or to say, well, I might want to change some things. You know what I mean? And knowing that that's not a wrong or a bad thing, just to have somebody look over your files and just say, all right, I agree, your doctor's doing everything right. And a lot of times, if I'm being 100% honest, we do tell the local doctors, you're doing a great job. Like, there's nothing I would change. You know what I mean?
Awesome.
And so, but it gives you that reassurance to say, all right, I got one of these world experts looking at it and I'm on the right track.
Appreciate that you saying that too. Telehealth is a big thing, and it's actually on the docket for to continue that aid in policy. And one of the I don't know the number of that a particular proposal in government right now, but to continue to maintain and make telehealth a permanent thing across the board. So I appreciate you sharing that. I got to get back to you, Gary. So all the wonderful things of that we talked about. I want to talk about the positive. Dr. Blue mentioned, how you doing now? What have you been doing since you had the CAR T therapy? Tell us some of the successes, because there are some, and that's the beautiful thing that comes out of this whole thing.
Yeah. So when the time came and I just wanted to touch a bit on Dr. Blue's communication skills and how great it is. Is that
I didn't pay him to say this.
I
I
was
promise.
ready to say, it's some heavy bread transferring that.
What's your cash app again? No.
Ah,
so towards the end of like 2021, I noticed my numbers were going up. My IgG numbers and all that stuff. So met with Dr. Blue, and we were just like, okay, look at the current treatment isn't working anymore, which is normal. So we decided on the next route. First thing he said, FDA just recently approved the CAR T on the second drug, on another drug that twice in 1 year, and 2 drugs in 1 year for the same treatment, CAR T treatment. He's like, I want to put you on the list, but in the meantime, we have to put you on a treatment plan that's going to keep you stable and get you ready for CAR T, because there was a waiting list and I couldn't go that long without some sort of active treatment. He pulls out a paper and he does the risk versus rewards and basically lists all the current treatments, all the prior treatments, and all the treatments I didn't have, and the combination of drugs. And we started to literally in the office discuss what combination of drugs would work best for me and what was going to be the benefits and the side effects and all of this. That communication is something that I think really is something that is so important, because not only does it set the ground for what I should expect in terms of side effects and other complications, but by involving me in my treatment plan, it also gives me the confidence to know that we're in this together. And he's very much invested in my success. And I'm not just another number, because of my previous work, a job working as a, I had a caseload. And so sometimes we get criticized for looking at people on our caseload as just a number, and we don't really see individuals.
mm.
So when people work in the public sector and, you have a caseload, it's very hard for you to mentally condition yourself to look at each person on your caseload as an individual who has each one of those people have different needs, and to kind of humanize those individuals and to provide the best services for them. And, Dr. Blue is very good at doing that. So with CAR T now, I've got CAR T in 2022. It's been 3 years ago, November of 2022, this week. And exactly this week, 3 years ago. It's been truly amazing. Realistically, there is no negative side to CAR T. For me, at least personally, there was no downside. So waiting until it was FDA approved, a lot of kinks were worked out, was the right decision. I had no side effects. I didn't suffer any neurotoxicity or any other complications. I've been disease-free now for 3 years. I'm not on any other treatments or medications for my cancer. I do take other medications for other issues, but not for the cancer. And I've been able to kind of do a lot of things. I've been able to focus my life on working. I'm not working. I've been focusing my life on, being a father and being a husband.
Things that matter to you. Things that matter to you.
Right. Things that matter to me was being there for my kids, being there as they go through their teenage years. My son is about to graduate from high school this year. And thank you. And travel with them. And, so we're creating memories. We're creating, those things that are important to me. And that's really what's important to me, just creating memories with my family.
Man,
and CAR T has allowed me to do that.
Man, that's so dope, man. Listen, man, this was dope. I really appreciate you sharing that. And every person's journey. I'll be clear. Every person's journey in treatment is all different, side effects and all those different things. But it's great to know that you're doing well. Before I close out, I wanted to say, what's one thing you would say to the men men, or the folks listening, but of course the men listening that might be scared to go get checked, what would be a message to them in general?
So I literally had this discussion, and it got kind of heated on Sunday with a group of individuals at a local cafe. I understand that, we as patients, I can't really speak as a provider like Dr. Blue, but I understand that we as patients, we have our own biases when it comes to the healthcare in America. Seeing the doctors, taking medications. There's a lot of conspiracy theories and things floating around. There's a lot of misinformation floating around. And, a lot of our experiences are also based on the way that people in our community were recently, or even not so recently, treated. Cancer treatment 20, 30 years ago is not the same as cancer treatment today.
Come on.
Right. And so, I understand that we had a grandmother or somebody who may have passed from it in the past, and the experience, was not necessarily the most pleasant or whatever, but we have to kind of be more critical thinking when it comes to making decisions that's going to affect us. And the thing about it is cancer just doesn't affect me. It affects my children. It affects my wife. So when I make decisions, I'm not making decisions based on my own selfish needs of what I want. It's really also, I have to look at the fact that I need to be there for them. My kids are in school. I want to be there in the best possible way, in the most capable way for them, so that they can have as much of a normal childhood into adulthood as much as possible. If you know what I'm saying. I want them to view me as just a normal person who is, who might be a little bit sick, but I'm still there for them. I can still take care of them. I can still provide the emotional support they need and things like that. And so I make those decisions with those things. In mind. I try to be as critical thinking as much as possible, looking at the data, looking at everything, looking at what I want, looking at what my family needs, and speaking to other people and other professionals and getting as much information as possible, and then making those decisions and to go ahead with it. But I think in our community, we do have a lot of people who tend to make decisions heavily based on their personal experience or their biases or what they think is out there in social media or out there,
and a lot of misinformation on top of it. And I'm not discrediting anybody's experience.
No. I think a lot of people don't understand. They should know, but social media seems to be the main source of information a lot of people seem to get these days. But the reality is that social media is both scripted and edited to deliver a specific message.
Right.
And that message isn't always the message you should be listening to and following and basing life and death decisions on. So
I'm going to just use this as a time to plug myself. So if you do look for somebody to follow, Dr. Blue MD is a good place to follow.
Oh my God.
Dr. Blue MD, you know what I mean? Through this podcast,
yes.
Just wanted to put that out there. Dr. Blue MD.
Yeah. So to your point, I'm going to let you piggyback off that, Dr. Blue. Gary, first of all, thanks for being here. Dr. Blue, thank you for also being on the show. Gary, thank you for sharing your lived experience. And I'm in complete agreement with absolutely everything you said, especially about the situation where, I have, my son, when I was diagnosed, was 3, and now I'm 11, and now he's 11. Well, my immune system might be 7 years old, but now he's 11. My oldest son, I did get to watch him graduate. I walked my daughter down the aisle without rushing. She didn't have to just hurry up and get married because I was sick. Those type of things. And you mentioned the word moments. I am big on that. We're just stacking moments because we're not promised tomorrow, even without cancer. And it's important. And of course, my faith is a huge thing. And I know you're a man of faith, and Dr. Blue as well. Dr. Blue, I want to say this, and then I got one last question I ask all my people. What gives you hope, Dr. Blue, when you look at the future of myeloma care and health equity?
Yeah, I would say the biggest thing that gives me hope is that we're getting closer and closer to curing this thing. You know what I mean?
Come on now.
I get tired of telling people that this is not a curable cancer. So the fact that we're getting closer and closer, I can finally tell people, say, hey, found the right recipe that's gonna put this thing to sleep and keep it sleep forever. So biggest thing that I'm excited about, because it's coming, like it's coming, and it's coming soon. So that's the biggest thing that I'm excited about. And then when it comes to like health equity and trying to make sure, I would just say that like there's more and more podcasts and more ways to get the word out. You know what I'm saying? The days of like just you got to know somebody's like, no, you don't really have to know anybody. You can turn on really whatever social media platform you want, you know what I mean? But it gives people a voice, you know what I mean? So that's why, I'm glad that we have platforms like this that's actually giving the correct information, and it's giving people who actually have walked in their shoes, right? There's some people who have never been a myeloma doctor talking about myeloma. Or there's patients who have some other type of cancer, but they've never had myeloma, but they're talking about like, it doesn't make sense, right? And so you have people who have walked a mile in these shoes, and they saying, look, I'm not telling you something I know, I'm telling you something that I've lived. You know what I mean? And so that makes all the difference. And so, like I said, God is going to continue to bless you, man, because this is a blessing what you're doing. You know what I mean? Like you're getting the word out, you're helping the people, and that's all we can really ask for in life.
Man, I appreciate that. And I didn't pay him to say that either. So listen, first of all, great guys having you here. I truly appreciate it. As you well know, I love, and I mean absolutely love hip hop. It saved my life. And I ask all my guests before we close, when you want to get hyped up, pumped up, and you geeked up, all that psyched up, all those kind of ups, give me one hip hop song that you bang. And I'm gonna start, Gary, looking around. See, I can see the gears churning. Look at, I can see the gears churning. Give me one hip hop song that you would rock out with. I'm gonna start with you, Dr. Blue, because Gary looked like he done pulled out the file, his playlist and everything. I'm gonna start with you, Dr. Blue.
So like I said, I'm from the South, you know what I mean? So I'm a big Lil Wayne head, you know what I mean? So Lil Wayne is my vibe. So if I put on Lil Wayne, a Millie, that'll get me.
Oh, a Millie. Yeah.
A Millie, I'm ready to go.
Say less. Shout out to Lil Wayne.
Shout out to Lil Wayne.
How about you, Gary?
I don't know. Like lately, I've been just rocking. Like in the last year or two, I've been keep coming back to Kendrick Lamar for some reason. Like
that's a good place to come back to.
Even like something like Tyler the Creator. Those two guys. But definitely like Eclipse. This last 3 months, really, honestly, been the Clips, and I can't even, like, the whole album is just lit. So honestly, I'm just gonna have to go with their last album, like from front to end. And so I'm just gonna leave it at that.
That's cool. Listen, Clips, the album was banging. I'm gonna have to co-sign that one. I'm gonna definitely co-sign that. And Lil Wayne, is Lil Wayne. I mean, what can you say? Gentlemen, I appreciate you. Thank you so much. Once again, please go get your annuals. Please get checked. If you got a pain that's been going on for the last 5 years and your cousin's telling you that's because you sit a certain kind of way, might not be the case. Please go get checked and let a professional, diagnose you and tell you what's going on. I am not a healthcare professional, but I'm definitely a myeloma patient. And as I always say, peace out and keep 50 guessing.
Peace out, bro.